I am a left-handed clinician, and today Taylor will be my patient, and I'm going to be performing an extraoral exam. So what that is I'm going to begin by looking at different aspects of your face, your head, your neck, and if at any time you feel any discomfort, any tenderness, soreness, just please let me know. Okay. So I'm going to start off by visually examining her overall appearance. I just want to make sure that it's very symmetrical. I'm looking for any moles, any freckles, and I'm not seeing anything. You look pretty good. So now I'm going to move on to the hairline. I'm going to be visually examining and palpating. So if you could please let down your hair for me. So I'm going to start off by visually examining your hairline. I'm going to start with your part. And I'm just going to go around and palpate. You could please put your head down for me. Thank you. And then you can go ahead and put your head back up for me. Thank you. Now I'm going to move on to the scalp. I'm going to be sectioning 1 to 1.5 inches and just visually examining and palpating the scalp. And for the sake of time, I would be doing the entire head, but I'm going to just stop here and move on. So if you could please put your hair up for me, and I'm going to throw my concept applicator away so I do not cross-contaminate my applicator. And now I'm going to move on to the ears. I'm going to visually examine and palpate those. First, I'm just going to put forward, up, just make sure I don't see any abnormalities. Then I'm going to palpate. And now I'm going to be doing this on the other side. Going forward, up. Okay. Now I'm going to be moving on to the lymph nodes. I'm going to first start off by doing your cervical chain. So if you could please turn your head to the right and then just a little bit down for me. Thank you. Going to start off by visually examining and palpating the anterior portion of the cervical chain. Going to be going superficial first. And then deep. Now I'm going to move on to the posterior region, so I'm going to go superficial first. And then deep. Now I'm going to perform this on the other side. So if you could please tilt your head to the left and then down for me. Thank you. I'm going to start off with the anterior region first, superficial. Now deep. Now moving on to the posterior, superficial cervical. And deep cervical. Now I'm going to move on to the supraclavicular lymph nodes. So if I could please move your shirt, would that be okay? Mm-hmm. Thank you. And I'm just going to visually examine and palpate the supraclavicular lymph node. Going to be doing this on the other side as well. Is it okay if I move your shirt on this side? Mm-hmm. Yep. Everything feels good there. Now I'm going to be moving on to the occipital spinal fissures. So if I could have you put your head down for me. Thank you. And I'm going to use both hands to palpate the occipital lymph nodes. And then I'm going to move right into the spinal accessory. Now I'm going to be moving on to the auricular areas. I'm going to first start off by doing the post-auricular. Going to be visual examining and palpating this. And then I'm going to be moving on to the pre-auricular. And then I'm going to follow that right into the parotid lymph node. Now I'm going to be doing this on the other side as well. I'm going to start off by going to the post-auricular. And then the pre-auricular. And then to the parotid. I'm going to be moving on to the submandibular and submental lymph nodes. So I'm going to pull her cheek up. That way I can visually see this. And I'm just going to palpate all the way down. And again on the other side. Pull the cheek up so I can visually examine and palpate at the same time. And now I'm going to move on to the submental lymph node. I'm going to place my thumb here and just feel that hip and pull. Okay, now I'm going to be moving on to the salivary glands. I'm going to start off by doing the parotid. I'm just going to feel around this gland. And now to the other side. Okay, now I'm going to move on to submandibular. First off, I'm going to start by looking for the anteguinal notch. So once I've located that, I'm going to palpate down. Could you please put your tongue on the roof of the mouth for me? Thank you. Right into the sublingual. I'm going to perform this on the other side as well. Sorry for the lateness. Okay, locate that anteguinal notch and have your tongue at the tip. Thank you. Palpate right into the sublingual. Okay. Now I'm going to move on to your sinuses. Going to be doing the frontal sinus first, visually examining and palpating. Now for the ethmoid sinuses and the maxillary sinuses. Okay. Now I'm moving on to the masseter muscle, so if you could please clench your teeth for me. Yeah. And I can feel the muscles, so I know they are clenched. And now I'm going to move right into your TMJ. So if you could open for me, and then close, and then open, and then close, and then open one more time, and then could you please do a lateral excursion side to side for me? Move your jaw, thank you, and close. So I did feel a little bit of popping, so I am going to use my stethoscope to listen in. Just make sure. Okay. Could you open for me? And then close, open, close, open, side to side lateral excursion for me, and close. Thank you. Now I'm going to be looking on the other side as well, listening. Open for me, and close, open, close. So one more time, lateral excursion side to side, and close. Perfect, thank you. Finally, I'm going to be looking at the thyroid area. So to do this, I'm going to give you some water. You're going to take 3 sips, and once you take your sip, if you could please keep that until I tell you to swallow. That way I can visually examine your thyroid. Okay, so please take your first sip. Hold it. Okay, hold it. All right, go ahead and swallow. All right, thank you. Now I'm going to be doing the left side, so if you could take a sip. And I'll be palpating this and visually examining at the same time. Go ahead and swallow. Okay, thank you. And then can you take one more sip for me? Hold it. And go ahead and swallow. Perfect. Thank you. And this concludes my extraoral exam for today. Thank you.